Welcome back to Talk of the Town. Lowcountry Orthopedics provides comprehensive patient-centered orthopedic services including cartilage restoration, joint reconstruction and replacement, pediatrics, sports medicine, trauma, fracture care, and physical medicine. Here to tell us more specifics about their practice, Dr. Douglas Scott. Dr. Scott, welcome to the show.
Thanks so much. Great to be here.
So you are in two locations. You are down near the hospital, and then, of course, in the new center up on, it's in the Bluffton area.
Over in Bluffton. That's
yes.
Right, the Bluffton Medical Campus.
Yeah. Oh, gosh, it's fabulous up there, too.
Yeah, we're very excited about that building. It's really kind of a multi-specialty group, so we have internal medicine doctors and an endocrinologist. There's a new OBGYN unit. So
wonderful.
So really the mission of that building was to have a big location with comprehensive medical care to treat everyone in the community.
Well, it certainly looks like they accomplished that.
Yeah, it's been great. Yeah.
So let's talk a little bit about ortho surgery.
Sure.
What all areas does that encompass?
So great question. So in orthopedic surgery, probably the biggest thing to think about and for people watching to remember is that even though we call ourselves orthopedic surgeons, and that's probably our specialty, is doing the technical aspect of orthopedic surgery, really the mainstay of care is really helping people without surgery. So even though we call ourselves surgeons, the vast majority of patients are people who come in with some sort of musculoskeletal pain, some sort of orthopedic pain. Either my knee hurts or my shoulder hurts or I fell and sprained my wrist.
Right.
And even though sometimes people get a little worried about seeing a surgeon, but the vast majority of what we do is to help people without surgery. And really, I think for most things, any good doctor would believe surgery kind of is the last resort.
Right. So more of a preventative type of care is what you're trying to
right. And even
provide.
If someone does have exactly. If someone does have an injury, typically we let that heal without any surgery. So really, our mission here is we really have a great team. I handle mostly sports-related types of issues, and also encompassing a lot of upper extremity things. So specifically with shoulder and elbow issues. And then my partner, his name is Kirk Johnson. He specializes in adult reconstruction, and he's a Harvard-trained specialist, so he's too modest to talk about all that. But he's really, a well-recognized leader in doing hip replacements and knee replacements.
Wow.
So between the two of us, we really have a good breadth of really helping all kinds of patients with me kind of doing upper extremity things, and him doing hips and knees. Yeah.
Dr. Scott, so we live in a very, from young to older, I mean, our area is very athletic. So
absolutely.
What are some of the things that you see coming into the office?
Very common. So that's probably one of the more exciting things about practicing here is there's really almost what's becoming a subspecialty of helping mature athletes that we call them, and people that are just in great shape, very active, and that's a lot of our community. So, but with that kind of wear and tear that goes along with the body and just being so active, comes with just a lot of pain and just typically just kind of the knee or the shoulder or the elbow wearing down a little bit, which is extremely common. And just, again, the mainstay of care is really helping people with non-surgical things, whether it's a cortisone shot for a little arthritis in your knee or some physical therapy for some tendonitis in the rotator cuff. Really focusing on a specific diagnosis and identifying that, and then being able to treat those kind of issues with non-surgical means to get people back on the golf course and on the tennis court.
And I would think it'd be very important for them to come to you immediately after recognizing there's some sort of problem or some sort of pain associated with their movements.
That's a good thought. There is typical type of soreness and wear and tear, and some people just start by taking an Advil or a leave before they play golf. But anything that's persisting, anything that's really anything that you're noticing constantly or every day, or a lot of people have pain at night, even with rest. And something that's interfering with doing what you want to do, that's the reason to have us take a look.
Obviously.
That's why we're here.
So how about shoulder pain, some common causes of shoulder pain? I actually had a frozen shoulder, which
very common.
People were like, what is a frozen shoulder?
Very common, very common. So again, probably the most important thing, if you're having some pain in the shoulder, a lot of the pain to a layperson, to a citizen here is it just seems like pain in the shoulder. So it's really our job to identify different aspects that could be causing it, whether it's a frozen shoulder or an issue with the rotator cuff or arthritis in the shoulder or maybe a pinched nerve or something. So there are all different types of things, and that's not for the patients to worry about. That's my job to worry about what exactly the problem is, and focusing on directing even though the pain can be very similar for people, identifying exactly which one of those is going on so you can direct appropriate treatment. And again, if you had a frozen shoulder before, a good example of something that, again, the vast majority of time as long as you identify the
Right.
problem and start treating it effectively, you know, the vast majority of people do
and
well
physical
without.
therapy was fabulous. So
Yeah,
that's
physical therapy,
yeah.
sometimes some anti-inflammatories, and
Yeah.
typically it cools down without any surgery.
Yeah,
Yeah.
yeah. Well, Dr. Scott, thank you so much. All your
of course.
information will be on the screen, as well
Sure.
as phone numbers and email or website. Not
Sure.
your email. Your
That's okay.
website.
Yeah, that'd be all right. Yeah, we do house calls and things. Yeah.
So
sure.
thank you so much
Yeah,
for
of
joining
course,
us
Andy.
today
Yeah,
and for
good
the
to see you.
information.
Thank you. Thanks for
Absolutely.
your time. Appreciate it.
And we'll be right back with Talk of the Town.